We would be discussing the prevalence and comorbidity of borderline personality disorder in this lecture. We have discussed in the previous lecture that this disorder is characterized by instability. The general feature of this disorder is instability, which generally begins by early adulthood. It is one of the most common mental health disorder. On an estimate 1.1 to 2.5% of general population, 10% of outpatients and up to 20 to 50% of patients who are seeking psychiatric help have BPD. We must keep in mind that despite the high statistics, there are many cases of BPD in which the diagnosis is made very late or sometimes not even made at all. Now, why is it so? Why do so many cases of BPD go undiagnosed? One possible explanation is high comorbidity and other problems that are associated with this disorder, which complicates the diagnostic process. Comorbidity is the simultaneous presence of two or more disorders. That is, the patient has more than one mental health disorder, which complicates the diagnostic process, and that is why in many cases BPD goes undiagnosed or the diagnosis is made very late. BPD is a disorder in which the chances of comorbidity is high and diverse. Apart from BPD, the patients can have depression, eating disorders, social phobia, PTSD, or relationship problems. Any or all of the above mentioned disorders can be comorbid with BPD. Though the degree can be stronger or weaker, a common combination is that of BPD along with narcissistic, antisocial, histrionic, paranoid, dependent, and avoidant personality disorders. We can only imagine how difficult the diagnosis can be. Various studies have shown that when anxiety and mood disorders are comorbid with personality disorder, it is treatable. However, in the case of BPD, one must be careful to only treat the disorders such as depression, eating disorder, or any other disorders that we discussed above. It should be noted that BPD is a serious disorder that results in permanent disturbance in patients' life. There are numerous crises and suicide attempts, which makes the treatment of comorbid disorders quite difficult and challenging. The symptoms of other disorders often change in nature and scope when they are alongside BPD. This is what makes diagnostic process even more difficult. Therefore, the treatment of BPD takes priority. We must treat BPD before treating the other disorders.